Okay, so the most important point that I could make is that we don't want to be moving the brush just like this. This is what most people think you can do with braces. When you do that, you're only polishing the braces, whether they be clear or metal. It just doesn't work. We wish it did, but it doesn't. So here's what we call the push and the wiggle. So here's the push at 45-degree angle, just slant angle like this, and not straight like this, not 90 degrees, but 45-degree slant. And then the bristles are pushed in, and then you begin motion of the toothbrush only after you have gotten all the way in there, touching the gum tissue lightly, not digging into the gum real hard, but just making contact, and then you begin motion of the brush at that time. And this is a very effective way to brush the teeth. After this, you notice there's two or three teeth that are contacted by the bristles. Now, when you finish this, then you would take the brush and move it at a 45-degree slant this way, and then push it down into the crevice, and then you would only begin motion after you had made this entry of the bristles past the bracework. And it's very simple, and you just go around like this, and in a minute and a half you can do the lower and the upper. Lower, of course, is like this, going in, 45-degree slant, then wiggling, going in, and then beginning motion only after in there, and so forth, and then coming underneath and getting into in those crevices, and then begin motion at that time. Now you can see now with this patient we have a little room for improvement. Here the gum tissue looks healthier. Here you see the redness and largeness. This is because this patient could be better getting the bristles inward like this, and going like this, and going all the way around. And then, after doing that, then coming, first we said we would go like this, right? That we were saying on this slant. So it would be this slant first, and then after doing that, then coming underneath. So now if someone this is a good demonstration, because if someone has some swelling of their gum tissue and they are going to start doing this, they are going to notice bleeding and soreness for about 10 days. Okay, so that will last about 10 days. And then if they're brave enough to do this, then that will be the end of the gum tissue brushing question, and everything will be fine. And then on the other surfaces of the teeth, the biting surfaces and the tongue side surfaces, well, that can just be brushed in a normal manner. So the whole thing should take about a minute and a half to do everything, including all the push and the wiggle, and then the regular biting surfaces. If you do that once or twice a day, if you want to do it 3, that's great, but if you do it once or twice a day, you'll stay out of trouble, and you will avoid all marks on the teeth, which is, of course, what we want, and we don't want to have a person to have any gum swelling. No, we don't want them to have gum surgery or anything like that. So it's very important.